Bismillah Rahman Rahim. I am Dr. Raja Mehdi Hassan, Chief Cardiologist, Islamabad. Today topic is the risk factors of uh, heart attack. As you know that heart diseases are very common, and especially the heart attack is very common, not in US and in all of the Europe, but also in in Asia. 20 million people dies of heart attack annually, and in Pakistan and in our suburbs, about 3 to 4 lakh people dies of this heart attack. Heart attack is nothing but it's the combination of different risk factors. If we control these risk factors, then we have to reduce the ischemic heart disease and heart attack. There are numerous risk factors, which some of them are. It can be divided in two types. Look at the chart over here. These are the modifiable risk factors and non-modifiable. In modifiable risk factors, first is the walk and exercise. If we do daily 40 minutes of walk a day with empty stomach, we have to reduce the heart diseases by reducing the cholesterol level, by reducing the hypertension, by reducing the sugar level, and make you fresh and healthy. The second modifiable risk factor is healthy diet. You have to take the healthy diet with fresh fruits and vegetables, and avoid the cholesterol rich diet with oil and ghee and these sugary and oily products. Uh, the third one is the hypertension. Hypertension is the main risk factors. If someone has, then it has double the chance of heart attack, and it's the main risk factor, and it's also known as the silent killer of the silent killer with and also it's the father of diseases. If we control the blood pressure within normal limits, say up to 120 by 80, and by uh, our lifestyle and by good diet, and if not possible, then we have to take some medicines by to control this high blood pressure. If once the medications are started, then it should never be stopped without the advice of your concerned doctor or your cardiologist. Next modifiable risk factor is the diabetes mellitus. As know that the diabetes mellitus, which is in our words, it's sugar. Uh, we have to reduce the risk factor. It's normal levels with blood sugar fasting. It's less than 100 milligram, and after you have to take the diet or your breakfast, then it should be less than 160 milligram, and the HbA1c level, which is the test for after 3 months, and it should be less than 6.5 grams per deciliter. This is the main risk factor. It's also the silent killer and mother of diseases, and its control is mandatory in order to avoid the further complications of diabetes, like heart attack, renal failure, or stroke or hemorrhage. The next modifiable risk factor is the hypercholesterolemia. The normal cholesterol level within the body is less than 200 milligram per deciliter. There are four types of cholesterol. One is the cholesterol level. The second one is the LDL level, which is the lethal cholesterol, and it is the bad cholesterol and should be less than 150 milligram per deciliter. The HDL levels, which is also the good cholesterol, and it should be more than 50 milligram per deciliter. And triglyceride levels, which is concerned with the food, related with the food, food which contains the cholesterol levels, and it should be avoided, and fried and uh, cholesterol level food should be avoided. The next modifiable factor is the tobacco. The tobacco contains not only the cigarette, but it also contains naswar, shisha, hookah, bidi, or the anything which contains the tobacco, and it's very harmful, not only for the cardiac diseases, but also it also causes several types of cancers. So you should avoid this tobacco in your life. The next is the obesity. The obesity is the main risk factor for cardiac diseases, for hypertension, for sugar, and your joint diseases, your immunity, and so many other diseases which are related with this obesity. So you have to control yourself, control your weight within normal limits, and that your BMI, if you know your height and weight, you have to calculate the BMI levels. It should be within normal limits up to 25. BMI is normal, 25 to 30. It's overweight, and more than 30, it's obesity. So you have to control within normal limits. The next and the last factor is the stress and the anxiety. It's not directly related with the risk factors, but it aggravates the your high blood pressure, your sugar level, your obesity. You have to take the more food, and this stress and anxiety should be avoided by taking walk exercises, and you should busy yourself in your further activities. Um, these all are the modifiable risk factors, and these next are the non-modifiable risk factors, which cannot be controlled by ourselves. It's the genetics. It runs in families, and if it's in families, you have to check yourself annual basis, control your sugar and blood pressure levels, make yourself smart and healthy, and avoid smoking in order to avoid the cardiac diseases. Next is the age. Age is progressing with time, and you have to do nothing with the age. Next is the sex, male or female. Some diseases are common in male or some are in females. So you have to be careful in future to avoid such type of diseases. In short, if you walk daily for 40 minutes with empty stomach, or you have to take the healthy diet with which should be rich with the fruits and vegetables, and avoid oil and ghee and these sugary products, and you have to control your high blood pressure, your diabetes mellitus, your obesity, your cholesterol level. Then you will be a healthy man, and you should be careful, or you should be very far from the heart attack and heart disease. Well, thank you very much.